Assalamu alaikum and welcome back to Medicower on IQRA TV. I've been talking to Dr. Gordon Sinclair in the first part of the programme about skin lumps and bumps, and we've had a little bit of a conversation already about verrucas and warts and things that are called sebaceous cysts. So if you've missed that, I hope you'll go back and watch that later on. The next part of the programme is very much around things that are a little bit more serious, and I guess what we need to understand, Gordon, is why should we go and see a doctor about skin changes? What's the sort of things that would trigger us to go and see a doctor?
So I think the key thing here is that if you or somebody else close to you identifies something that's different, right, that has developed in a short space of time that wasn't there before, that is on the skin, and you're unsure what it is, then I think it probably would be reasonable to seek medical advice. We all have, everybody, absolutely everybody has different changes in their skin. Yeah. We all have moles, we can all have little coloured lesions on our skin. We have them from birth, and we get more of them as we get older.
Oh, do we? Okay, I didn't know that. Okay.
The skin changes throughout everybody's life. So we know that there's things that change all the time, but what we're trying to pick out is those things where there's a bit of a quicker change to the skin that you've not really noticed before. Or if you have something that you've had for a long time that suddenly starts changing.
Okay, so it's not about it necessarily hurting or itching or something, it's about you've noticed a change and better to get reassurance than to leave it.
So, yeah, so I mean, obviously if something is particularly hurting and you can't work out a reason why it would be hurting, then that might be significant. Although generally with serious things, they don't tend to hurt.
Okay.
They can sometimes be itchy, although not always.
Yeah. I know.
So itching and pain, the sensation from them is less specific to what it is.
But it's interesting you say it's not just about what you notice, but people close to you might notice.
Yeah, so sometimes people have things on their backs, they can't see them.
Yeah. And your husband or wife
but their husband or wife might say, I've not noticed that before.
Yeah. Okay.
And then, so I have a lot of people come to me and say, my wife told me to come because she's worried about this area on my back that she thinks has changed.
I guess as patients we worry about wasting a doctor's time, but it also sounds to me there's a relevance in getting reassurance, excuse me, from your doctor as well.
Yeah, it's a fine balance. If it's just a very minor change and it's not overly, don't come rushing with everything to the doctor. But I think if it's something you are worried about and you think that is a definite change, better to come earlier and get, even if it's just for reassurance, than to delay until things have changed beyond what could be a simple cure.
You mentioned beauty spots, and I've always wondered the moles and beauty spots, because I've always thought moles were more raised and beauty spots were flatter.
Yeah.
Are they the same thing?
They're basically the same thing. So moles is the lay term for an overgrowth of the particular cells in a particular area, which is usually causes, in most cases it will be a flattish, darker, pigmented, smooth, round, circular area.
Called beauty spots.
Beauty spots usually will be if they're around the face.
Oh, is that what it is?
Or on the face, so they're well known, but you get moles anywhere in the skin.
So is something changing them always serious?
So all moles can change, as I alluded to earlier, can change through your life. So moles generally can get a little bit thicker. This is over many years. Occasionally they can change slowly in colour, so they could get darker or lighter.
Okay.
But if that's a slow change, then I wouldn't be too worried about it. Moles don't generally get bigger in size. They can become more prominent, but don't generally enlarge in diameter.
So that sounds like they can get fatter but not bigger.
Yes. Yes.
All right. Let's go on to, because I know we're going to run out of time so quickly with this show, and I really want to talk about skin cancer without wanting to alarm everybody, but at the same time, you know, what can you tell me about skin cancer? And I guess one of my first questions about it is, can darker skinned people get this?
Absolutely. Anybody can get skin cancer. When you add up the different types of skin cancer, it's a relatively common cancer, although the really serious type, which is called melanoma, it does have quite a high press profile. Melanoma, because it's dangerous, and that's the one that we need to try and identify early. That's the rarest form, but approximately every year 2,000 people die from melanoma. If we get it early, and these days we tend to be better at getting it early, it's got a 90% survival rate at 10 years. So what does that mean? That means everybody who's been diagnosed with melanoma, at 10 years later, 90% of them will still have survived and probably have a cure. But we still have 2,000 people dying from it every year. That's nowhere near the numbers of the more common cancers, like breast cancer or bowel cancer.
So what are the signs that might make you think that might be developing? Would we necessarily pick it up before you? I'm going to talk about is the A, B, C, D, and E of skin changes. All right.
Now, some of the terms I'll explain what they are. So A means asymmetry. So asymmetry means there's a difference in shape of the lesion. So most moles tend to be fairly symmetrical, round, maybe a bit oval, but symmetrical in. So when you get abnormal ones or cancerous ones, they tend to become more unshapely, irregular.
Like the ink spot kind of patterns.
Yeah.
Right.
So that's A. So that's a change you can look for. B is the border. Right. So the obvious border of the area becomes irregular. So this is where you get cancer growing out irregularly around the border of the mole. So the vast majority of moles tend to have a regularish border. C is colour. So this is where you get a variability in colour. So as I said before, moles slowly can change their colour, but when you get a sudden darkening, for instance, within a mole, and it's irregular, that would be significant and would need checking out. D is diameter.
Right.
So this is where you get they tend to be larger. So they talk about the head of a pencil, the blunt end of a pencil. Normal moles can be bigger than that, but if it's bigger than that and it's got some other features of change, then that should be a warning sign. And E is enlargement. Right. So that's where it's enlarging, either in diameter or thickness. All of those are about the changes that occur over a reasonable space of time. So it might be within a couple of months you're noticing those changes. So that means we've got to rule out a melanoma. If we get it early, it's usually curable because it can just be removed. The danger of melanoma is it can spread to other parts of the body. It's one of the cancers that does spread.
Yeah, because I can imagine people that have got things going on with any condition, not just with skin changes, and people start to worry about cancers. And actually, one of the biggest habits people have is to get worried and then not see a doctor because they don't want to hear. But actually, what you're reminding us of is that actually, if you get a diagnosis early, your chances of getting better are much better.
Yes, and a lot of the ones that come to us won't be melanomas. They'll just be. We'll be able to say no, it's just a normal change in a normal mole. Or if the doctor is uncertain, we would tend to nowadays refer on to a specialist to get them to have a specialist look at it.
What are the main reasons people get skin cancer?
The biggest reason by far for melanomas, all the skin cancers, is ultraviolet light exposure. So that's the ultraviolet radiation, which predominantly that'll be from the sun. So people who have more sunlight exposure and don't protect themselves against it are more likely over time to put themselves at risk of having skin cancer of any form. So that's why
I'm just going to, sorry to interrupt, but I'm just thinking that many of our communities come from hot countries. And I know your statistics are linked to the UK, but this is one of the questions I ask about darker skinned people in countries where we've got hotter suns. We don't hear about these, or maybe we do, and I just haven't heard about it. But are the same risk factors there for people that are born and brought up in hotter countries?
So the risk of skin cancer is reduced in people with darker skins.
Okay.
We know that you have the protective effect through having darker skin, and that's why because you're in a hotter country. Otherwise, people in hot countries would be having skin cancer a lot more.
Okay.
So we know there's a protective effect. So fair-skinned people are much more likely to get skin cancers. Melanoma is actually a slightly odd one out, because there are people who can. There's probably a predisposition, a risk that you'll get it just possibly from your genetic makeup. So we know that melanoma occurs in young people as well who haven't had a lifetime of sun exposure. Yes. So probably one of the most famous ones is Bob Marley,
right.
The reggae singer. He died at age 36 from a melanoma.
Oh, did he? I didn't know that.
And he had, he did, and he had one of the unusual ones, which is particularly seen in Afro-Caribbean people, which is on the sole of the foot.
Oh, wow.
So you think, why does that? So that doesn't get exposed to sunlight, but it's just one of those peculiar things.
Okay.
There's a particularly aggressive form, which is more common in certain races, if you like, where it can be in certain areas, and that's a particular one. So there's always exceptions to the rule.
Of course, I guess what we're trying to get to the bottom of is what do we do to prevent it, and when should we be coming to see a doctor about things? And you've already said it's about changes that A, B, C, D, E. So
and that's specifically mostly about melanomas, but there's two other commoner causes of skin cancer which also need medical attention, both of which are again caused predominantly by sunlight, and but we see those more than melanomas. So there's one that's, the lay term is a rodent ulcer, predominantly on the head or face.
Just say that again, it's the rodent?
A lay term is called a rodent ulcer. It has a slightly ulcerated appearance. It's a circular thing. It's a slow growing one. So this is when you get an area of the skin that just doesn't seem to heal, and it just stays there. And it never seems to heal.
Also makes me think of it being open though as well.
Yeah, it has a sort of slightly raised edge, so it's not necessarily ulcerated in terms of having removed the top layer of the skin, but it has the appearance of an ulcer. Okay, all right.
So anything like that we need to see.
So anything that's not. So if you have a consistently non-healing patch of skin, then again I think that needs checking out.
Sure. Okay.
The other one is another common one is. So the other thing to say about the rodent ulcer is that that doesn't spread. It's not dangerous like malaria. It doesn't go to other parts of the area. It doesn't, and it wouldn't be fatal in that sense. Okay. But if you leave them alone, they get bigger and bigger and bigger and bigger.
So they do need treatment.
So if you get them early, you'll have a smaller scar. When you have it, it does need removing.
Yeah. And it's going to leave a scar.
Yeah.
Okay.
So the other one's it's called a squamous cell cancer. That arises from the top layer of the skin.
Okay.
At the top there, and that's and again it looks slightly different to a rodent ulcer. It's difficult to describe the appearance, but GPs would usually try and differentiate the difference.
So even more reasons why we should get these things checked out.
Yes. Okay. So the squamous cell one is a bit more dangerous than the rodent ulcer, but not as dangerous as the melanoma. Okay. It sometimes spreads if it's more advanced. Okay. So again, another reason to come in early to get it checked out.
So we've talked about the sun being the main cause for the cancers that we're worrying about. Yep. What do we do then as a community? Because we can't just stay indoors all the time. We do need to work. We do need to travel in the sun. What are the best ways to look after our skin to help reduce those risks?
So protecting your skin. So using sun lotions and protective creams. So if you're in a particular hot environment or it's a particularly bright sunny day, you should be using sun protection.
On the face, on the hands, if you're covered like me, you'd still use it? Yeah,
on the exposed areas. Yeah. So the other way to do it is to wear adequate clothing. Yeah.
And then we get told we're going to not get vitamin D, don't we, of course? It's a fine balance, isn't it?
There's always, yeah, there's a balance between, but I think protecting your skin. We've already said that dark-skinned people have a lesser likelihood of having the cancer. If you're covered up, that reduces even more. But still, with face exposure, and it does take quite a lot of ultraviolet exposure to cause damage. So, but even in a British summer, even this summer when it wasn't that hot, you can still get ultraviolet damage.
And is it right, it's between the sort of when the sun's at its highest point, so why they say don't sunbathe between 11 and 3 or something?
Yeah, that's when it's hottest, that's when it's brightest, that's when you're most likely to burn. So burning of the skin can cause damage, which over time can then become cancerous.
Okay.
So wearing hats, covering up, putting lotion on.
Keeping in the shade.
Keeping in the shade. Even in this country it's important, but particularly if you're on holiday in hotter countries, or you're visiting hotter countries, and you're not used to it, it's even more important that you do that. And
is that the same sort of advice you'd give for babies and young children?
Yes. Yeah. Definitely, even more so.
Even more so.
We know that damage that occurs early in life could, over time, develop into future possible cancer change.
Okay.
The other thing I haven't mentioned is artificial ultraviolet exposure, so the common use of sunbeds.
Okay.
We know that melanoma, the incidence of melanoma is increasing. That could be partly due to a change in the population, immigration, etc. But a big factor is probably the rise of sunbed use over the past 20, 30 years. So the advice really is don't use sunbeds.
Yeah, look, it's, I guess,
Or if you do, use them for the minimum time. I think you see the ones where you go 3-minute exposures.
I think the sort of self-tanning stuff is taking over, but I don't know if there's risk factors in that personally myself.
I'm not aware of risk factors from self-tanning.
Skinny tans are the new thing, I think, at the moment.
But sunbeds are, from a medical perspective, probably a big no-no. They're just compounding the effect of the sun in a very concentrated form. Okay. I understand why people want to do it, but...
Yeah, well, you know, some of us are naturally tans, what can I tell you? We get the benefit of that. Okay, just coming back to the issues about the symptoms of cancer.
Yeah.
Are you always going to have itchy skin, seeping skin, or skin that hurts? And is that always a sign of cancer? I think earlier on you said it doesn't always hurt.
No, I would say that they're not, those symptoms aren't specific enough to say that they're not specific to cancer. So if you have cancer, you might have none of those. You probably won't have any of those, actually.
Okay. So those are better than, so the worry is if you've got changes and actually there's no...
So things that seep or are painful are probably more likely to be an infection. You may still need to see your doctor or maybe visit the pharmacist for advice before going to the doctor, but they're less likely to be cancerous in that case, unless they're associated with the other changes we've already mentioned.
Okay. So let's say, for instance, I came to you with something that was changing, and as my GP, you're looking at it and you're thinking, actually, this isn't one of the things that I think isn't serious. I think it might be something that could be serious.
Yes.
What can I expect you to then do after that?
So as a doctor, if I'm worried it's one of the cancerous diagnosis, I would want to send you on to a specialist to get that confirmed and seek their advice about the best management of it. So nowadays with cancer treatments, you would be seen within a couple of weeks of referral. If we suspect
any type of cancer.
If we suspect it's a serious cancer. The only one that's different with skin is the rodent ulcer one, the slower one, that isn't treated with the same urgency as the others, but would still need referring for probable removal.
Okay, and then does your role as a GP then stop with the patient? Is it all hospital care after that?
It's predominantly hospital care, assuming that it is fully treated by the hospital. There may be nothing further for the GP to do, but if you have complications either from the treatment or there is for instance, heaven forbid, secondary spread of the cancer, then I think the GP would be involved in supporting patients through subsequent treatment. So it might be you might need to have chemotherapy, for instance.
Yeah. Which is its own sort of topic on its own, isn't it? Really,
that's
it's
a whole
yeah.
whole topic. Well, that's generic across cancers, really.
Yes. Yeah.
It's not specific to these, but the more serious skin cancers do have those sort of treatments available to them at the more serious end of the spectrum.
Okay.
But most of them, if we, I think the thing to emphasise again is if we catch things early, you can usually remove the cancer and then it's gone and it doesn't need any further treatment.
Are the skin cancers less recurring than other types of cancers if you catch them early?
Yeah. So the two less serious ones, the squamous cell and the rodent ulcer, they're usually treated just by removing them. The melanomas are the ones that are more risky. So sometimes you can remove them and you can't find any spread, but it's possible it could come back later at another time. So you can never be 100% sure. The specialists have a grading mechanism for assessing the severity of the cancer, and they will work out a likelihood of that to occur. And the earlier you get it, the less serious is the grade and the more likely it is completely cured. Hence the 90% survival rate we talked about earlier.
So really you're reminding us the importance of any changes in your skin that you're worrying about, that you're noticing are not normal for you.
Yep.
Don't delay really getting it checked by the doctor.
Don't delay getting it checked by the doctor. Doctors generally don't mind seeing things where the patient is worried. And there is a significant change. So I would far rather see it and make sure that you're either strong reassurance, no, this is okay, or we need to do something else about it. Or it might be that we'll just keep an eye on it for a couple of weeks and see if there's any other change.
Sure. Okay, thank you. Anything else about skin cancer you'd want to cover that I've not asked you about, Gordon?
I think we've covered the main things on skin cancer. Highlighted the main causes and the things to look for, the changes in the skin.
Can we just go through your A, B, C, D, E again, just to remind us?
So A is asymmetry. So that's a change in the variability in the shape of the area. That's A. B is the border. So it's no longer round, it's irregular. C is the colour, and by that I mean a variation in colour.
To what is normal for it?
To what's normal for it, yeah. So a variation or change in the colour. D is the diameter. So if it's bigger than the head of a pencil, than the blunt end of a pencil, then it's just a factor to consider in association with the other ones. And then E is enlargement. So it's where you've had something and it is obviously enlarging.
So it could be any of those. There's not that the whole list has to be there.
It could be any of those. The more of those you have, the more likely it's pointing to it being something sinister that would need checking out more.
And early treatment better. Yeah. Okay. All right. Thank you. That's really helpful.
But in terms of the size one, I think the size one is. It's an interesting one. So the big ones tend to be, but you can have smaller ones. If it could be smaller than that and still be a new one that has changed.
Yes.
So you don't have to wait until it's got
that's a good
that
reminder,
big before worrying about it. Obviously, the smaller it is, the more difficult it is to detect change. That's the problem. So.
We've got 2 minutes left towards the end of the show, and I wanted to just slip in the little bit that should benefit our teenage population out there, acne. What do we need to know about acne, and how can we help our youngsters sort of deal with it better? Especially if they're struggling, they're having a really bad bout of it. Yeah,
so acne is very common. I mean, it's almost normal for most teenagers to have some form of spots at some point during their teenage years. So we know it's related to the hormonal changes that occur in teenagers as they're progressing into adulthood. And it can be very variable. So some will have some occasionally will have no spots, will have perfect complexions. They're the lucky ones.
Yep.
Most people will have occasional spots. Some people get the condition of acne where they're getting recurrent spots.
Just 1 minute now left.
Yes,
before.
and
So
it can be on the face, on the back and on the chest. The face is the commonest area that people worry about because it is so visible. And I think the thing we underestimate probably is the emotional or psychological impacts
So how would we help
that
them?
have that. So there are treatments available. If it's mild, there's simple treatments you can get from the pharmacy, but don't worry about coming to see your GP about getting more regular prescribed treatment. We can't cure it. It's not really curable, but we can improve it.
Okay. So now let's come back to your top tip for the whole subject today then.
Top tip for the whole subject is be really aware of sunlight, overexposure to sunlight or ultraviolet radiation. That is the thing which is probably the most dangerous to our skin.
Sorry, it seemed a bit rushed, that last part, but I really appreciate all that you've said to us today, Gon. Hopefully everybody's found that really useful. Inshallah, we'll see you again next time on Medic Hour. Assalamu alaikum wa rahmatullahi wa barakatuh.